Hello, my name is Jim Cullafello, and I'm the Vice Dean of Academic and Student Affairs at the Ira Fulton Schools of Engineering at Arizona State University. It's my pleasure to welcome you to our National Academy of Engineering Grand Challenges for Engineering Speaker Series, hosted by ASU and sponsored by the Kern Entrepreneurial Engineering Network. This engaging speaker series will focus on the 14 Grand Challenges for Engineering in the 21st Century. Esteemed speakers from across the nation will be sharing their expertise on these grand challenges and answering your questions. We are proud to be a part of the NAE Grand Challenge Scholars Program, preparing graduates to address these challenges. It's my pleasure now to introduce Dr. Ramakrishna, the Director of the National Academy of Engineering Grand Challenge Scholars Program Network, to share his welcome.
Hello, my name is Ramakrishna and I am the Director of the National Academy of Engineering's Grand Challenges Scholars Program Network. The NAE Grand Challenges for Engineering, identified in 2008 by a committee of the National Academy of Engineering, are 14 critical global challenges for engineering in the 21st century, united by the mission of continuing life on the planet and making the world more sustainable, more healthy, more secure, and more joyful. The Grand Challenges Scholars Program, inspired by the NAE Grand Challenges, reflect the rapidly evolving nature of engineering education. The goal of the program is to prepare engineers who not only have the necessary technical skills, but also the cross-disciplinary knowledge, entrepreneurial spirit, the global multicultural perspective, and a sense of societal mission needed to meet the global grand challenges facing humankind in the 21st century. As of November 2018, 65 institutions across the US and around the world have implemented this innovative educational program, and nearly 100 are getting ready to join the consortium of GCSP schools. We at the National Academy of Engineering are thrilled that Arizona State University has taken the initiative to organize this series of presentations that will highlight each of the 14 NAE Grand Challenges and provide this valuable resource not only to its own students and faculty, but to students and faculty from around the world. On behalf of NAE, I'd like to thank ASU and the Kern Foundation for making the presentation series possible. I'm eagerly looking forward to following how this series impacts and inspires the next generation to create solutions to our society's most daunting problems. Our best wishes for a successful series, and thank you very much.
Hello, my name is Amy Trowbridge, and I'm the Director of the Grand Challenge Scholars Program here at Arizona State University. I would like to welcome you and thank you all for being here as part of this speaker series event tonight. Tonight, Dr. Dayaprasad Kulkarni will speak about connected humanitarianism, affordable medtech, and the future of global health, which is broadly related to the grand challenge of engineering better medicines within the theme of health. Following his presentation, you will have the opportunity to submit questions for Dr. Kulkarni, and I'll ask him your questions along with some of my own. I'm excited to welcome and introduce Dr. Dayaprasad Kulkarni, Assistant Professor of Biomedical Engineering at Syracuse University. Dr. Kulkarni has over a decade of experience in creating innovative solutions to healthcare problems for populations underserved by capitalist healthcare systems. He is the founder and director of Arogya Seva Global Health Volunteer Alliance, a transnational, not-for-profit micro-volunteering platform that provides marginalized individuals and communities with access to local, sustainable, quality, and comprehensive healthcare for low or no cost. He has advised several startups to rethink public health problems through technology solutions. Under his mentorship, 250 students, innovators, and entrepreneurs across Indian and American universities have designed and developed humanitarian healthcare technologies. Some of the current and ongoing student projects include a low-cost bone drill, a portable dialysis machine, a suicide prevention app, a mobile-based national cancer registry, a telepathology app, a supply chain management system for humanitarian outreach, 3D printed prosthetics, as well as on-demand and on-site 3D printed medical consumables. Please join me in welcoming Dr. Kulkarni.
Good afternoon, everyone. My sincere thanks to the National Academy of Engineering, the Kern Entrepreneurial Engineering Network, Grand Challenges Scholars Program, and the Ira I. Fulton School of Engineering at Arizona State University. Before I say anything more, I want all of you to close your eyes for a minute. I won't disappear. Now, I want you to imagine a medical condition in your mind. Imagine a healthcare problem that has affected you or someone in your life. A contracted disease, an accident, a genetic condition, a disability, or even being in a natural disaster. How did you overcome this challenge? How easy or difficult was it? How long did it take for you to get the solution? How much did it cost you? And how far did you have to go to find the right answer? Well, I'm sure many of you have mixed feelings and thoughts about this. Many of you have used solutions that already exist. Can we have the slide, please? Vaccines, emergency responses, medications, surgeries, assistive devices. Now think about who has access to these solutions. Is it the rich, the insured? Is it someone who's located close to a hospital? 7th of April is World Health Day. Does anyone here know what the theme is for this year? No? Okay. This year's theme is universal coverage. Right? And the World Health Organization estimates nearly half the world's population lacks universal coverage. That's more than 3 billion people. So by and large, we've found solutions to many of the world's most pressing challenges. But those that have accessibility to benefit from them are often limited by a variety of factors, including financial, geographic, political, and environmental. Today, we will talk about how we can remove these barriers and make health and healthcare accessible by discussing connected humanitarianism and affordable medical technology. I strongly believe this is going to shape the future of global health. I'm going to take you through the story of how open source engineering solutions can help us democratize accessibility to healthcare solutions. The problem that I will be focusing on today is the lack of availability of affordable, low-cost, lightweight, upper limb prosthetics. And the solution we will be exploring is the now ubiquitous 3D printer. Available in high schools, in universities, even homes of enthusiasts, similar to the 3D printing lab that you have in your engineering department at ASU here. To start with, I'll introduce you to some stories that demonstrate how the challenge of prosthesis for all can be addressed. Two distinct stories of individuals from different continents, but facing the same challenges. 3D printing technology has helped vulnerable individuals gain access to lightweight upper limb prosthetics. The little girl you see in the center of this picture is Miss J. She's a 10-year-old who loves playing video and whose family was unable to find her functional, affordable prosthetics for many years. Incidentally, I will be seeing her in a couple of days, and I'm excited to see the feedback she has for us with the hand she's been using. Right? Dr. Patil, who's a volunteer with Arogya Seva and a Rotarian, he came across Miss J, of all places, at a hardware store. Well, she was there with her grandmother in central New York. Dr. Patil introduced her to us, and she received a functional free prosthetic hand the very next day. 3D printing made lightweight, functional, affordable prosthetics possible for Miss J in central New York with the help of numerous other partners. It could be the Rotary, the New York State Fair, where she received her hand, the IEEE, the Hands of Gratitude program, and so on. The most prominent barriers preventing individuals who didn't have hands or arms from receiving these upper limb prosthetics were twofold. One, there is serious dearth in the availability of these devices, which makes them costly. And two, the upper limb prosthetics that are available are poorly designed or extremely heavy and cannot be used. The utilization of open access designs, right, and 3D printing technology together helps to bridge this gap. This is Mr. S. We'll call him that for now. I met him during a medical camp of doctors from Ohio in partnership with the local Indian Rotary and Lions Club. He's from a village, a small village in southwest India along the coast. He's a shy 12-year-old who was very excited about the possibility of getting a hand. On the last day of the camp, his teacher actually brought him from his school after hearing about the camp and the hands that were being distributed. A few months after we met him, we were able to create a custom hand with custom colors that he chose and gifted to him for free. 3 months after we met him, when he finally got the custom hand, his teacher actually invited his family and friends to a school assembly. You can see his shy smile as he receives the hand in front of the gathering there, and everyone claps. This was the beginning of him coming out and gaining self-confidence. 6 months later, we met again, and he used this hand to actually turn on a 3D printer at a local nonprofit that became a satellite center to continue printing these hands for the local community. These are just two stories, but over the next few decades, the number of people requiring prosthetics and orthotic services is bound to rise because both the world's population and the life expectancy are growing. And as a larger population of age and will be affected with disability, the need for these services will rise proportionally. The world witnessing significant increase in musculoskeletal conditions, non-communicable diseases such as diabetes and stroke, which if they continue at the same rate, will greatly aid to the need of prosthetics and orthosis. Thus, by the middle of this century, the World Health Organization again estimates that nearly 1% of the global population will be in need of these services. That is, at that point, will be close to 100 million or more. The harsh reality in many countries is that only 5 to 15% of the population who could benefit from these assistive products have access to them, including prosthesis and orthosis. Even in high-income countries, many struggle to access these services. And this is just the tip of the iceberg. Just in our own database, we have more than 4,000 people who are on a waiting list to get these. So, what technology is going to radically increase the access to these devices? What is the most cost-effective way of making these high-quality devices available to these people? What factors influence how it reaches them? So in the next few slides, I will show you how we are trying to answer these questions and how 3D printing is giving us some of these answers. Some of you might have heard of this story. Ivan Owen, an artist who designs props and gadgets, he did not know that he was triggering a revolution when he created a mechanical hand for a steampunk convention and posted that video online. A carpenter in South Africa who had lost 4 of his fingers in an accident saw this video, and then he collaborated with Owen to create a prosthetic hand for himself. A mother who then by chance saw this project, she wanted a version of this prosthetic hand for her son Liam. Owen then realized that 3D printing can help create these solutions, and that was the beginning of this chain reaction. Liam is the first kind of known child who received this prosthetic hand. But that set off the chain reaction that combined with desktop 3D printing becoming affordable and more accessible. And that happened because the patent on 3D printing some of the patents expired by then. Because 3D printing has been around from '84, right? It's not that 3D printing was discovered 5 years ago or 10 years ago. But the patents expired, so it made the printers more affordable and accessible. And the solutions were being now openly shared, right? So people started using it as an ideal tool, not just to replicate what Ivan had created, but then they started personalizing innovation. They created their own creativity to it, fueled by emerging needs, as well as the simplicity of this process. And this led to designing of hundreds of prototypes, hundreds of devices, thousands of volunteers across the globe who started doing this, and several thousand hands distributed so far. All of this in the last 5 years. The Enable movement, many of you might have heard, has been at the forefront of this chain reaction. Again, with no disrespect to the LN4 hand, if you've heard of that, is another low-cost solution that has existed for a long time, that has had its benefits, has impacted a lot of people, but has not seen any innovation in its design over the years. It's being used as is, and it's being imported from the US. Whereas the 3D printed movement in the last 5 years has created numerous functional designs, prototypes, and has been successful in delivering it to people who need them. What also happened around the same time that helped this movement was the democratizing of 3D printing printers itself in a way. This iconic image, many of you might have seen, is of the RepRap machine with Adrian Bauer. This was a machine, a 3D printer, that could replicate itself. It could print almost all of the parts of the next 3D printer itself, right? So people started then using this to create the tool that could be used for scientific discovery, which is a 3D printer. So this made the potential limitless. And people started using this as a tool for various applications. It made possible for anyone who had an idea to quickly prototype a functional iteration, right? And they could also work on it and create newer designs if it did not work. So in fact, people then started using, if you look at this image, people started using 3D printing for so many other things. People print food, chocolates with 3D printers now, right? People use 3D printers to print parts for aerospace technology, in the fashion industry, in jewelry, arts, automotive, and so many different other applications. In fact, as we speak right now, John Perry is announcing probably the winner of Genius New York, which is $1 million prize for a startup. And some of the front runners in that competition have actually 3D printed their prototypes with the help of another startup, which is pioneering distributed 3D printed manufacturing. So this clearly demonstrates how affordable medtech can be a solution. We can see the extent to which this movement has created an impact in the last 5 years. It roughly started around 2014. But it cannot be done with technology alone. And this is what brings us to the second topic of discussion, which is connected humanitarianism. Who are connected humanitarians? And why should we be connected? These are the questions we asked when we first coined this term a few years ago. It was John Shull of the Enable movement, Arnan Zamir, who was then with Tom Global, and myself. We were excited when we were discussing the connected humanitarianism as a term, but also as a movement. Both the term and the concept has evolved over the years, and in the next few slides, I will show you my interpretation of that. I'm sure many of you have heard of the story of Stone Soup, Anyone in the audience who's heard of it? Okay, there are multiple versions. I'll give you my version. Strangers come upon a village where the locals are starving. They say they have a solution: stone soup. Though skeptical, the villagers are grateful to receive help and they want to do their part. To a pot of boiling water half filled with stones, someone adds some old potatoes, someone offers the last bit of dried herbs from their garden, a child offers tomatoes that they have been saving, and so it continues. Soon, from the scraps and bits from the home of everyone in the village, the villagers who haven't eaten in days have a delicious soup. The stones, of course, added nothing at all to the soup, save the idea of the soup itself. The grand challenge of providing prosthetics in this world today is not unlike the story of the stone soup. If everyone tries to do their part, we can do something great. And connected humanitarians understand this, and they're active rather than passive participants within these communities. The story of the stone soup highlights the fact that we all have something to offer, regardless of our situation. But knowing the end goal encourages people to help and gives them a purpose and gives them hope. So you see, in the end, they all had soup to drink. What stopped them from doing that before? They all had all the same ingredients before. The idea that someone came in and told them that you could make soup, right? The end goal they knew is going to be soup that they would get. They would be able to partake of it. Encourage them to come in and participate. And that is similar in our solution. If you remember, Dr. Patil met Ms. J in a hardware store. He did not have a solution for her. He did not have a hand to give to her. He did not have a 3D printer, or he did not know how to make that hand. But he knew that he could connect her to someone who could do that. So he was a connected humanitarian who played his role and introduced her to us. There were several other stakeholders who were involved. The Rotary helped with some funding. The New York State Fair gave us a platform to provide this hand. So each one played their role, and eventually the girl got the hand, right? So these are various stakeholders. You can look at the image, and by default, you as students, as faculty, as institutions, as universities, are an integral part of it, you like it or not. But rather than being passive participants, you can choose to actively connect with the rest of the stakeholders, understand what the end goal is, and give what you have in abundance. All of us have something that is in abundance when you compare it to someone else that does not have that component, right? And it's like a jigsaw puzzle. When we all come together and contribute what we have in abundance is when we are able to create the solution. And that is the basic idea of connected humanitarianism. So these two solutions together, connected humanitarianism and affordable medical technology, is what will actually help us to face the challenges that are in front of us today. So I would encourage all of you to actually actively participate and be a part of this connected community. Because in this slide, you will see there are 17 Sustainable Development Goals that the UN has come up with. They're all very challenging and very daunting. But if you see closely, they're all related to health. You take any of them, it ultimately, at the core of it is human health and well-being. And the end goal of any of this challenge is to keep humanity healthy and happy. And only if we are healthy and happy can we keep addressing new challenges that humanity faces. So the path definitely looks daunting, but we are not alone in this. There are several support mechanisms that are there to encourage us, to motivate us, to mentor us, and to support us if we choose to take this path. And this ecosystem has changed. These are just a few examples, representative of the ecosystem that is there. Compared to 15 years ago when I started in this path, today there are innumerable support systems that will help individuals who want to go out and make a social impact, who want to be change makers and create solutions that is going to impact society at large. So make use of this opportunity, and there are several examples that show the 3D printed prosthetic was one such example. And there are several other such solutions that have worked that are there as torchbearers. If you look at Bempo, for example, the idea started in around 2013, I believe. I personally have met Ratul when he was conceptualizing the idea in 2013 in Bangalore in South India. Today, the company has reached about 15,000 children, has saved nearly 200 lives. Even though it is a small company, it signifies the kind of solutions that we need for today. They understand local needs and provide affordable, customizable solutions. You can look up what they do. They provide their first device was a watch which monitors temperature and in infants. And just with that solution, they've managed to save 200 plus lives, and now they have several other solutions that are coming up with. So similarly, you can look at innumerable examples that are out there that are actually making a mark and making an impact. And I'm telling this because it's not just a problem of the developing world or of underserved communities. In the US alone, in the last 20 years, the spending on an individual for their health has doubled. This is definitely not sustainable in the long run. This is going to make healthcare less and less affordable for everyone. So we need these solutions not just in the global south, but also in developed, industrialized countries, right? So we need to see how we can learn from these solutions and get more for less. There are real social, practical, financial, and emotional effects to providing affordable medical technology. Ultimately, it comes down to this. The first thing what Ms. J wanted to do when she received her hand was to give me a high five. This is a very small thing, right? But you can look at the happiness on her face. You can look at the satisfaction that I have on that. And ultimately, whatever we do, is that individual happiness is at the center of all our efforts. And that is what will keep pushing us and motivating us to continue doing this work. So what humanitarian challenge do you want to solve? And what technology can you use? While you ponder over this question, I'll also let you read this statement, which in a way sums up the core philosophy of connected humanitarianism. Thank you.
Dr. Kulkarni, that was a great, inspiring talk and overview of how innovative solutions that utilize low-cost technologies like 3D printing can really help solve big health challenges and create real value for society and individuals and communities. I hope that all of you in the audience have learned something new about these humanitarian healthcare challenges and are also inspired to learn more and to take some action in solving these challenges and creating real value yourselves in the future. For the remainder of the time, we will give you, the audience, the opportunity to ask Dr. Kulkarni questions about his work, the field, or anything else that you're curious about. If you would like to ask Dr. Kulkarni a question, please submit them now. If you are joining us live, please submit your questions via text messaging to the number that was on the program you received when you came in today. And if you're watching remotely via live stream, please add your questions as comments directly through YouTube. We'll do our best to answer as many of your questions as possible. So please start submitting questions as soon as you have them, as soon as they come to mind. So we'll go ahead and take a seat, and I'll go ahead and get us started with a few questions of my own while we're waiting for audience questions. All right. So you shared some powerful stories and inspirational stories about how you've been a part of changing lives through 3D printed prosthetics as one example. So I'm curious, is this something that's happening in a lot of different places around the world as well, including industrialized nations as well as developing nations, et cetera? Is it just happening in a few places?
That's a very interesting question, because I am personally familiar with more than 20 startups in India that are working on developing several different prototypes of these low-cost upper limb prosthetics. Mm-hmm. The Enable movement that I mentioned is a pioneer. There are more than 80 chapters now across the world, more than, I think, 10,000 volunteers. Wow. Who are printing these hands, creating new iterations, new designs every day, right, to improve on what is existing, using the feedback from the users themselves. And then there are several other small companies like Open Bionics. LimbForge is a movement that emerged from the Enable. Several small maker spaces, nonprofits that are also adopting this technology very rapidly.
Okay, great. So you also, at the same time, mentioned some staggering statistics about this need of only 5 to 15% of people who could benefit from prosthetics actually have them, and that number is growing. So is it possible to meet that demand through these custom 3D printed prosthetics? Basically, is this solution scalable? Probably a hard question, but
it is, but I am an eternal optimist, and there is always hope, right? In just the last 5 years, we've seen there are more than 10,000 volunteers, more than 5,000 hands distributed, and several organizations, large and small, adopting this. So we've cracked one step in this challenge, that we've made the right noises, we've created the right interest and enthusiasm in this. Mm-hmm. The next step is to understand how we can distribute and transfer knowledge, right? And empower local communities to be creating this. Just in the last year, Arogya Seva itself has, with the help of IEEE Foundation, a couple of other funding agencies, we've managed to set up 4 satellite centers where we've trained local partners, installed 3D printers, and handed over the technology to empower them to be able to make these hands. We don't want to be a bottleneck in this. So it is definitely growing. Give us another 5 years. I'm sure this would have created that impact that we're talking about. Okay,
great. So what do you think are the biggest challenges to kind of meeting that demand? One of the things that comes to mind for me is the economic piece. Who's paying for this and how? It's great work. It's making a big difference. But how is that, happening? And
honestly,
what are the challenges?
Again, I don't think the economics is the biggest challenge.
Okay.
It doesn't, if you look at it, if you break it down, each hand that is 3D printed itself, just the printing, doesn't cost more than 20, 30, $50 maybe.
Okay.
Prosthetics now cost anywhere between $5,000 to $50,000. The real challenge is the next step. You can print as many in the ASU lab and have it available, but is it reaching the people who need them?
Yes.
That is the biggest gap. So how do we ensure that the people who need them in the places they are, have it available when they need it, not 10 years from now.
Okay.
Because they need it now. The people that I talk to, many of them are in their 50s, 60s, and they've never had a prosthesis before. So it's not just having the solution, but making it available to people who actually need them. Okay. And that is our biggest gap, I would say.
Okay. So switching gears a little bit, as an expert in this area, what do you think are the most important or critical humanitarian health challenges that we face?
There are several. The WHO, again, going back to WHO for everything, that for statistics, there are more than 18 million healthcare providers, workers that we need, that we don't have right now. Right? So how do we prepare and train these individuals who we need to provide these services? That, I feel, is a big challenge. With all the latest technology, with all the newer medicines, with all this discovery, the life expectancy of people is also increasing. So there are more people who are going to live longer, and with that, there will be more needs as well. So that is definitely another big challenge that we need to address. And at the core of all of that is also maternal and child health. If we have the foundation strong, then we have a perfectly fine house. So that is also at the core of the problem that we need to address. So these are some of the big challenges that we need to think of, I would say.
Okay. So in your talk, you focused on 3D printing, and I think we can all agree it's pretty amazing the things that 3D printing can do for health and also the other areas and applications that you mentioned. So what I'm curious about is, besides 3D printing, are there other technologies or tools that you're excited about or that you see great potential in for either application in these humanitarian health challenges or other applications?
Yeah, so I think there are different kinds of tools. According to me, there are several conventional ones, a real tool, a practical tool like the 3D printer, but there are several unconventional tools as well. And one thing that I feel is now, that I'm excited about is hackathons and makeathons. That's been there for a while now, but the extent to which it has scaled, the number of such events that you see happening, and it's not just events, right? The way these events happen has also evolved, and that I feel has a lot of promise. For example, the Startup India Hackathon, which is in its 3rd year now, and I had the opportunity to be an evaluator on that for this year, is one of the biggest in the world. The Ministry of Human Resource Development is involved. There are 100,000 plus technical students who participate in it. There are 500,000 plus students in general who are interdisciplinary students who are participating. There were 1,200 problem statements and 17,000 solutions that came out of that hackathon, right? And many of them may be just ideas, but a lot of them also go on to become then prototypes, get funded, get support to become startups and to actually provide these solutions to the people who need them. So that, I feel, is very, very promising. I'm excited about that, but it also brings in together a lot of different stakeholders. The government, for one, which is very important when we want to scale such projects. The industry, institutions. There were, I think, 3,000 plus technical institutes that were involved, that were participating. So that means that many faculty are connected. So there's institutional resource and knowledge that comes into this process as well. So I think that's one very clear example of a tool that I'm excited about that we should have more of. There are these large scale ones, but there are also several smaller ones that happen that have a very clear focus on what they want to solve. A recent one that I attended in New York City was to solve the challenge of substance abuse. There was another one that Stanford had, which was focusing on maternal and child health. And several of these actually go on to become trigger for creating a startup. They also help build teams, bring people together, and understand what skill sets they have to offer. So I think that's a great opportunity that is there.
Great, and that, I mean, that definitely goes along with the theme and some of the things you were talking about the connected humanitarianism and having those connections between people and communities. We've been.
So I just have one more thing to add.
No,
sorry.
go ahead.
So the other thing that is big that I think will also grow is online educational platforms. Because education, like I said, is very, very important. We have a big gap, and even if we have 50 years, it's difficult to train that many people and have them available. We have to do it at a much rapid pace as if we started it 10 years ago, right? And the only way we can do that is through technology. And there's several new online platforms that have emerged, that are emerging, that can provide skills. So DeSkilling is a key component when it comes to healthcare service delivery, because there's a lot of burden, maybe not so much in the US, but in a lot of other countries, there's a lot of dependence on the doctor. Right? That's one person who has to do so many things. In India, nurses cannot even prescribe medicines. So that's a bottleneck. And we have a shortage of 3 million plus doctors. That's not something we can create overnight. So DeSkilling and training people to provide those services is very, very important, and a lot of that can be done through online platforms, which I think is an exciting tool that is emerging.
Okay. So it looks like we have some audience questions coming in, so I'm going to ask one more question before we move on to the audience. So let's talk about why you're here. What inspired you? So what inspired you to get involved in the work that you're doing now? What is really motivating you most, or what motivates you most?
So I would say there are two things, again, going back to my roots. I'll quote two phrases in Sanskrit, Vasudhaiva Kutumbakam and Sarve Jana Sukhino Bhavantu. That means, Vasudhaiva Kutumbakam means one world, one family. Right? And that is what we are today. There are barely any boundaries across, with the internet, with all these technology solutions, boundaries are fast disappearing. Okay, I don't want to go into politics, but yes, so the idea of one world and one family. And Sarve Jana Sukhino Bhavantu means may all be happy and healthy. Right? So as a medical doctor in this world, I'm privileged to have that opportunity to be in this position. I am a bridge, a catalyst in a way between the medical and the engineering fields. And I feel that is my purpose, to be that catalyst, to be that enabler. Right? And this, again, the right things that happened at the right point in time, and my ability to take those opportunities in my stride and learn from that is why I'm here. One of the key reasons was the tsunami of 2004 that happened when, as I was graduating from med school, the tsunami happened, and I realized that as a doctor, that is what I was trained to do, was to go save lives. And I went on the third day to a coastal village on the east coast of India, South India. And that was a turning point, and it kind of started from there. So that's why I'm here.
Okay, great. So we'll go into some of the audience questions here. So first, can you see 3D printing starting technological advancements in other healthcare areas, and if so, where?
It already has. There are so many fields within the healthcare space that 3D printing is being utilized. Dentistry is one field, one specialty that has adopted 3D printing very well. There is also a lot of on-demand manufacturing that has happened. We've in the assistive technology space, we're creating a database of 3D printable medical consumables that's going to make a lot of these devices and consumables affordable and accessible. There are organizations like Doctors Without Borders that are rapidly adopting 3D printing technology, also funding research to be able to provide the solution in the field for them where they cannot have stocks of supplies. And this is a very real solution. Organizations like Field Ready, there are several groups that are working on developing using 3D printer as a tool to print medical consumables in the field on demand. Wow. There's a lot of 3D printing that's happening with pre-surgical planning for complicated cases, cancer, pediatrics, cardiology, and so on. So there's a lot of this happening already in the healthcare space.
Okay, great. So next one, how can we globally contribute to chronic health conditions that require continuous monitoring? Is it realistic at this time?
Can you repeat the question?
How can we globally contribute to chronic health conditions that require continuous monitoring?
Yeah, so again, technology is a real solution. Knowledge sharing is something that we can use to help and monitor. AI, IoT are solutions that are being used in chronic illnesses. Blockchain is another technology that is being used in cancer diagnosis and treatment that can track individual therapies and learn from it to adopt therapies for other individuals with similar or same kind of affliction. So I think that's one way of addressing that question.
Okay, and in mentioning that, you mentioned a couple other technologies there that could be used for those as well. So that shows some other areas of technology that could be developed and applied to help with these challenges. So another question, there are lots of models for 3D prosthetic organizations. What are the models that have succeeded? It's probably a hard one. But.
Yeah, so there are, again, I think this field is still evolving. We are trying to create models that can be replicable. It's still very disorganized, I would say. And as a group, as a collective, I think we need to connect some more and brainstorm on what can work. There are a few torchbearers that are doing really well, that have succeeded. But there's still certain challenges in this space, like the socket for the terminal devices. There are a lot of 3D printed models that provide terminal devices, but the socket is a bottleneck because it is customized, right? Mm-hmm. There is a company, a startup in Canada, for example, NAE Technologies, that is trying to solve that problem by creating software that could be helping design these sockets or pre-design these customizable sockets. So I think it's still a learning curve. I don't believe there is a clear answer to that question yet.
Okay.
But I think the onus is on organizations that are in this space to actually connect and come together to brainstorm this. It's a very important question.
Okay. So the next one is, how can we engage engineering undergraduates in connected humanitarianism?
I think, like I said, there are so many opportunities. The first thing is for you to actually make that decision and take that leap of faith. Once you get in, there are so many people to handhold you, to support you, to mentor you, to guide you in the right direction so that you can actually use the skill set, the resources, the energy that you have to create impactful solutions that will go on and make a difference in the lives of other people. So the biggest barrier is for you to actually take that leap of faith. And that's what you need to start with. All of us have that potential. We can actually make a difference, and having that confidence, having that passion and persistence with hope is what I think is the way forward, and to jump in and to get on board. Everything else will fall in place. I'm an eternal optimist, so that's my answer.
All right, good. So it looks like you've inspired some people here today. So the next question is, how can I get involved with 3D printing prosthetics to benefit underdeveloped communities as a college student?
We are always on the lookout for individuals, volunteers who have access to 3D printers. Like I said, we have a wait list of several thousand people who need these hands. So if you have access to a 3D printer, if you have interest in being a part of it, you can go onto our website, or you can reach out to me directly and I'll get you connected. And there are so many different ways of helping. You can actually print a full hand and send it to us. You can print parts of the hand and send parts, components. You can build a team and then work on a hand. There are several teams that are, as a part of their university capstone, are building real hands for real people. right? And that's spread out all across. In fact, there are some hands in the room which you can take a look at and see some of the solutions that we have here. So reach out to me directly if you like on our website. There are also several other organizations that provide volunteering opportunities. It's very easy. Google and you'll find 20 opportunities. But yes, feel free to reach out to me and I'll get back to you for sure. Thank you.
Awesome. So we'll go back. Let's see. I think I've got another question. Okay. So beyond the obvious improvements to health and quality of life for these individuals who are receiving the prosthetics or other medical care, what impact does your work or these improvements have on the communities themselves? So in other words, what value are you creating for the people in these communities?
There is a lot of intangible value that is available and that is not measurable, right? When you saw the video of the little girl, that smile is something that you cannot put a value to. And that is very important. When you're providing solutions like this, the empowerment that you do in communities, the self-confidence that you provide to show that they are able to, especially with the satellite center, for example, right?
Yeah.
That they are able to design and solve problems that they are facing can mean a lot. And hope is a very crucial thing. And when they have that, the self-confidence that it builds within the community, the understanding of the resource that they already have, right? And how they can put that together to benefit themselves is a very important learning, I would say, that emerges from this. But it's not just the beneficiary in that sense, right? We always talk about the volunteers who are also real beneficiaries in this process. There is a lot of learning for them as well. And because if there was nobody at the receiving end, who would you give to?
Yeah.
So I always tell our volunteers that you are not doing a favor on anyone. Right? You're privileged to be having that opportunity. So that is definitely, I think, some of the value add that comes through the system.
Great. So as we're getting near the end here, I'd like to return to the call to action you provided to the audience at the end of the talk, encouraging them to all think about what humanitarian health challenge that they want to solve and how they want to do it. That's a big question that represents great opportunities, but I'm sure there's some students and others in the audience who might be unsure about how to get started. And you've talked a little bit about steps they can take towards taking action on it, but what do you suggest they take as first steps towards identifying a challenge that they are interested in and passionate about and want to act on in the first place?
Yeah. There are two things. There are several technologies that are there. 3D printing is one. I talked about AI, IoT, sensor technologies, wearables. These are all things that are going to keep growing and will make a huge impact in providing scalable solutions in the healthcare space. But also understanding the ecosystem is very important. Immersion within, right? You cannot be in a well and look at creating solutions for the world, right? So you need to step out of that well, connect with people and understand what the real needs are. And you can only do that when you're actually interacting with the real stakeholders. Yeah. So that is something that they need to do, understand. The second is passion. There are a million challenges that we are facing and as many number of solutions that we have. And we cannot go out and solve all these problems. So we need to understand what we are passionate about and then make that commitment and be persistent with that. Right? So I think when you realize what you're passionate about and you're able to make that commitment, and the next step is to live up to that commitment for yourself. So these are, I think, the steps that somebody should take if they want to get involved.
Awesome, great. So that's all the time we have for today's event. Audience, shortly after this event, you'll receive a request from us to complete a survey about your experience at this event. Please take a few minutes to complete that survey and give us feedback so that we can improve for the future. Our last event of this series also for this semester will be next week, Wednesday, April 17th at 10 a.m. Right here in the same location. We'll have Dennis Bonilla, the Chief Technology Officer for Ball2 Studios here, discussing the grand challenge of enhancing virtual reality and other immersive technologies. So please check out our website tomorrow for more information on that and to register. Audience, please join me in thanking Dr. Kulkarni again for a great, inspiring talk this afternoon.
Thank you.